At Aspire, we empower and connect our community with tools and resources for advocacy, education, support, and awareness. We know that PANDAS is a devastating disorder, but recovery really is possible. And we know that early diagnosis and treatment can lead to improved outcomes. So at Aspire, we aim to improve lives of those affected by PANS and PANDAS by helping to close the gap between the onset of symptoms and the start of treatment and support. We have programs that reach 5 core audiences to increase awareness and understanding on a national level while providing critical support to all members of our community. We are fortunate to be able to be supported by our professional advisory board and all of our volunteers. So we are able to present the programs that we do today. For the national general public, we have awareness campaigns and educational outreach. For families and patients, we have one-on-one support, educational programs, and for our parents and adult patients, we have a Facebook group that you can join, and along with a few new programs launching soon. For schools and educators, we have a lot of toolkits and handouts for schools, but we also provide in-services to educators and nurses for free, thanks to our donors. Plus, we have lots of information for parents on the website, and we recently added a few new sections. For legislators, we have information on how to get started in the legislative process. If you're in a state that doesn't have anything happening already, and a team, I highly suggest that you look at some of our resources. We also create state pages for the boots on the ground state leads so that they can put all their information about call to actions about different legislative matters. And then we spend a lot of time talking to legislators on the phone and writing letters in support for different bills. And as far as our providers and clinicians programs, we recognize that our providers have a tremendous amount on their plates as they care for our loved ones. So we have started a program in which we provide doctors and therapists with literature on PANDAS that they can hand out to their families. Our webinar series, we've divided it into 5 categories so we can support many different audiences within our PANDAS community. So we have the 5 categories are treatment and scientific updates, behavioral health, integrative medicine, school support, and family and patient support. Tonight, we're so fortunate to have Sheilah Gauch come speak to us on understanding and managing caregiver trauma associated with PANDAS. I'm lucky to call Sheilah a friend, and we've gotten to get to know each other over the years, and she does great work in our community. She is a licensed social worker, licensed principal, special education administrator, has been doing this, working in this field for over 20 years. And now she is the principal and clinical director of Dearborn Academy in Massachusetts, which is a therapeutic day school that services students with social, emotional, and learning needs. She is also a mom to 2 with PANS. So she lives and breathes what we go through, and it gives her an incredible lens to merge what she knows as a mom and what she knows as a social worker and what she knows as a clinical director and principal of this wonderful therapeutic day school. She's done incredible work in our community, working with and starting with Jen Vitelli and others, the Mass Coalition of PANDAS, and they were pivotal in getting the legislation passed for not only insurance, but also a council. Done wonderful work there. She's also a board member of the Alex Manful Fund, and she helped establish NAPA, which is National Alliance for PANDAS Action, which is a legislative advocacy group. And she's done more work and got wonderful awards and all sorts of things like that. And she recently published an article in Psychology Today, which is linked on the page that you registered through on our website, so you can look at that easily. So take the time after this webinar to read that sometime this week and share with your school. It's very interesting. So I'm going to stop sharing my screen.
Psychology Today actually gave me a blog. So
oh, good. So she
has,
oh
yeah. So I'm just we infiltrated Psychology
right.
Today. Thank you everyone for coming, and Gabriella, thank you for hosting me. I so appreciate being able to be part of this webinar series. So we're going to talk about kind of parenting a PANDAS child, understanding your own trauma. So you heard a little bit about my background. I have 2 children who have PANDAS. They were missed for most of their childhood. So we thought it was pretty significant mental illness, and only learned about it probably about 5 or 6 years ago. And they have been healing in ways that are so unexpected to me. I've never seen anything like it as a social worker, that I really have just kind of run towards it, wanting to understand more about it. So you heard a little bit about my background. I'm also initially my very first job out of grad school was working in a residential treatment center with significant trauma. So I do have a background in understanding trauma, and I think I have really tried to learn and understand kind of what's happening for me as a caregiver, kind of through this lens and understanding with my mental health background, and then also as an educator. So hopefully this will be informative. So our goals for today are to understand what trauma is, learn what's happening in your brain. Well, I'm going to learn what's happening in your brain during a stress response, identify the barriers and obstacles that combine to create complex trauma, and identify some different ways to support, hopefully. Okay, so I really like this quote. I think most of you who are on here, I'm sure, have heard about how significant the caregiver index burden is for us parenting children with PANDAS, right? I believe the Stanford study put it akin to Alzheimer's, caregiving someone with Alzheimer's disease. But I thought this was a great quote, and it's in the Wall Street Journal. So post-traumatic stress disorder in combat soldiers is receiving greater attention and wider societal recognition. Now, doctors and researchers are trying to do the same for a group that has similar symptoms, parents of children with life-threatening medical conditions. And I think everyone on this call would acknowledge that PANS really is a life-threatening medical condition in many ways, right? Some children have lost their lives to it. Some are really struggling with intrusive thoughts of self-harm and suicidality. It's a really impactful, significant illness to be managing. So that's just kind of framing our work. So what is trauma? I felt like this was a good definition of trauma for us. Trauma results from the exposure to an incident or a series of events that are emotionally disturbing or life-threatening with lasting adverse effects on the individual's functioning and mental, physical, social, emotional, and/or spiritual well-being. So I think for us, it's kind of that series of events, and it's pretty constant and prolonged. If you are a PANDAS parent, you are definitely dealing with over a long period of time, kind of sustained fear and stress. So, okay, so before I start that, so the first part of this talk, I'm going to break down what's happening. So trauma actually originates in our limbic system. It's right where our amygdala is. It's actually, interestingly, the same part of the brain that's impacting our own children. It's what I call being mapped down differently. So we are experiencing it differently as a result of multiple things that we're going to talk about tonight. But what I wanted to do was kind of first give kind of the neuroscience and the background on what's exactly happening in your body when you're having an acute stress response, because it's the culmination of the stress responses over time that is really impacting your body, and you are mapping down these responses, and we're going to talk about what that means in a little bit. So I'm going to start to go through what's happening when you're having a stress response, right? And this is having a child with PANDAS is stressful. So we're going to walk through that. Oftentimes I feel like when I work with students who have really significant anxiety, when I work with caregivers who may have anxiety, really being able to break down what's happening in your body kind of establishes a little bit of a locus of control, that this is something that's happening to you and you understand what's happening in your body. When you understand it, hopefully you can find ways to support yourself in managing it. So that's what we're going to start with. So you saw my first slide. Anxiety is a physiological response to a supraprimal survival mechanism. So when under stress, we all have a stress response and we all behave predictably in one of these three ways: fight, flight, or freeze. So this is my antelope in the Serengeti slide. It probably dates me to National Geographic days. But so really what it says is when our brain fires up and says that there is a lion in the room, there is a danger, it is an acute danger, and it could cause us imminent harm, right? Our body has this amazing protective mechanism that says, you've got to get ready to either fight that lion, freeze and play dead, or flee and run away as quickly as possible, right? Okay. So this I find to be, it was actually one of the caregivers I work with actually turned me on to Dr. Stephen Porges and the polyvagal theory of a trauma response. And I just think this is a really helpful tool to understand that our initial response is actually fight or flight. Freeze is a secondary response, and it comes when we're acutely stressed, right? So fight or flight and then freeze. So I always ask people when I do these trainings to think of what your stress response is. And then I usually share what mine is. So I automatically go into fight mode. I am an advocate. I want to make a good case to help my kids. I always joke with educators that you're probably going to get several emails from me explaining what's happening for my kids and how they might be able to help. However, if it's sustained over a long period of time, I am, or the fear is so big and it's a really big, scary, panicky thing, I'm actually going to freeze. So I'm going to curl up like a pill bug. I'm going to roll under my living room sofa, and someone's going to have to come find me because I'm so stressed, right? So I just use this to say there are different, fight or flight is your first response, freeze is a secondary response. And I really like this for all of us. We're going to talk about it later. But you can see the social engagement. So when your body and your brain comes back online, we are just social animals, we're social beings. And so social engagement is actually what really brings us back to center. So that's our kind of first take at this, and you'll see it again a little bit later. So one of the things I really love to talk about, and actually our whole staff is trained in this kind of neuroscience of the brain at the school I'm at. And we really like this hand model. And it just gives a really easy explanation of what's happening in your brain when you're having a stress response. So I'm going to break down this video into different parts, and we're going to listen to Dr. Siegel talk about actually the amygdala first.
One of the most rewarding experiences for me has been to study brain science and apply it to the experience of parenting. And the hand model of the brain that I use to teach parents is very useful to understand that. So if you take your thumb and put it in the middle of your palm, put your fingers over the top, this is a very useful model of the brain. And when we can actually see in front of us what's going on in the brain, then we can change what the brain does. So let me walk you through very basically what happens in this brain and the structures in it. And it goes like this. The spinal cord comes up representing the wrist, and then you have coming up into the skull, the brain stem and the limbic area, which work together to help regulate arousal and your emotions and the way you have a fight, flight, freeze response.
Okay, so we're going to start here, and I'm going to do the hand model of the brain. Okay, so this is your amygdala, okay? And when you have that initial fight, flight, or freeze response, so if you pretend like you're driving down the highway, if you think about a time you've been driving down the highway and someone puts on brake lights in front of you and you have to slam on your brakes to avoid a crash, right? You might feel that initial flood of adrenaline go through you, right? So that's your amygdala firing up, and it's going to it's going to go to your brainstem, and it's going to tell the rest of your body there's danger. There's an automatic danger. I might get hit, and your whole body, your brain sends out, and your amygdala tells your body it's time to fight, flight, or freeze. Like there's imminent danger now. And it sends into your body a flood of stress hormones. So norepinephrine, adrenaline, cortisol, all get your body ready to kind of fight, flee, or freeze for your life. So some of the physical manifestations of this amygdala and your limbic system firing up are really multifaceted, and you may have different kind of ways that your body presents when those stress hormones hit your body, right? But you may have a racing heart rate. You may have muscle tension. You may just automatically start to cry. You may have difficulty breathing. These next two are really significant because the reality is we have, like, a lot of our students or a lot of our kids, right, may have headaches or nausea when they get really anxious. So what I will say is that when you are running from a lion, like it's the fictitious lion, right? But you're running from a lion in your brain, and your brain is telling your body to get moving, and your amygdala fires up. All non-essential systems actually get shut down, right? So you actually don't need to digest any food if you're running from a lion. So whatever you ate for dinner, you don't need to digest. So basically your GI tract is going to get shut down. So it makes a lot of sense that you feel nauseous. And I feel like a lot of times what we say about people when they're anxious is, well, they're just anxious. That's why they're nauseous. Well, yes, except there's a real physiological process that's happening that's really significant. And if you can kind of ride out the process, you'll find the nausea will go away. And the headaches make sense because if your body's not used to having adrenaline and cortisol and norepinephrine, you may get a headache from it, right? Your working memory drops significantly because you don't need pre-calculus or algebra if you're running from a lion, right? You do not need to hold that information. You need every single ounce of kind of energy and focus to get away as quickly as possible. And you're unable to concentrate, right? Because again, you don't need to be reading a book. You're running from a lion. And that's what your body is prepping for when this amygdala fires up and sends all those stress hormones into your body. Okay. So the next part of this, we're going to talk about the cortex. So I kind of just break this down into chunks so we can understand all the parts of the brain really easily. All right.
These are below the cortex, the limbic and brainstem areas, and the cortex is this higher part of the brain that allows us to perceive the outside world, to think and reason. And this frontmost part of the brain, right behind your forehead, so the person's oriented like this, is actually the part that regulates the subcortical, limbic, and brainstem areas. This regulation is very important because sometimes we can have all sorts of things happen in our life. We're tired.
Okay, sorry, I was supposed to stop that. Okay, so here's your amygdala, right? And your cortex is wrapping around like this. Okay, and this is your thinking brain. Okay, so there are two pathways to a stress response. The first is an automatic firing of this limbic system. That's your downstairs brain. It's in response to a trigger before you can even think. So there's a lion in the room. I've got to go now. Okay, and then your cortex wraps around this amygdala, and you can actually fire off this amygdala with worry thoughts. It's happening from this thinking brain here. Okay, so this is kind of that ruminating. You may feel like, as you're listening to this, that, wow, this actually sounds like my kids too. Yep, it's all stemming from the limbic system. Your children, more than likely, if they have PANDAS, have pretty significant OCD, right? And it's all stemming, OCD is actually stemming from this cortex and that perseverative thinking, right? That keeps worrying this amygdala into firing off. For us, it might be a little bit different, and it is a little bit different, but it's all stemming from the same place in our brain. And that's why this is kind of a great piece just for all of us to know and have. Okay, so I like to put this part in. I like to talk about kind of the evolution of the brain a little bit and how this frontal lobe came to be. So there's a psychologist named Dr. Catherine Pittman who does kind of a neuroscience. She has a book on rewiring the anxious brain, I believe it's called. And I took a course of hers at one point. And so she tells this story. You can see this hut here and the stream. And she tells this amazing story of how our frontal lobes came to be, how we came to have what she calls planning circuits, worry circuits and planning circuits in our brains that allow us to future predict dangerous situations. So she talks about a prehistoric woman who built her hut with her children and her family close to a river. And she realized as the river started to rise, that if she didn't move her hut, her children could be swept away down the river, right? So that was a prehistoric woman. And now here we are. And these, she talks about these worry circuits, right? And then these planning circuits that this woman really started planning to alert herself for danger. And here we are in 2022, and our brains are really, our frontal lobe is really fine-tuned for that, right? We can future predict. Many people would say, although I think there's some research to indicate that animals actually do have some future planning, but would say that humans are really unique in this way, that we have this ability, this thinking brain, along with this frontal lobe to really future predict and plan for danger and make accommodations. So I just like to put that in because I think it's significant, right? It's a really significant part that actually kind of leads our brains sometimes to misfire a little bit, maybe. So this is from Dr. Pittman as well. So it's kind of talking about the appropriate use of worry, right? So when I do this slide, I often talk about, I'm going to just take a really mundane task. So let's say I have to, after this webinar, I have to go get milk because my son needs his Cocoa Pebbles tomorrow. And I've got to go out and get them and we all know that sometimes we just have to get these things so that there isn't a crisis in the morning and there's nothing to eat. So I have a worry that, oh my gosh, it's going to be 9:15 by the time I can go to Shaw's. So I'm going to make a plan. And my plan is that I'm going to make sure that I go get my jacket, get my coat on and everything, and run down to Shaw's before it closes at 9:30. Okay, so I have a plan. I had a worry. I have a plan. If I let that plan go and I don't even think about it again, I'm good. That's the appropriate use of worry. It's not that I make a plan and then I double back like 10 times, like, oh my gosh, okay, it's 9:15. And what happens if, my son took the car and now I can't get down there? Am I going to have to walk? Will I have enough time? And now I have a worry. I've made a plan. I'm doubling back on my worry. I'm making a new plan and I'm stuck in a loop, right? So that's not the appropriate use of worry, because getting milk actually isn't a lion. And I'm thinking so much that I'm now firing my amygdala up, and it's telling my body that there's danger. There's no danger. It's just milk and Cocoa Pebbles, right? But that's what's happening in my brain. Okay. So here's the last part of Dr. Siegel that we'll listen to.
Areas. This regulation is very important because sometimes we can have all sorts of things happen in our life. We're tired, we're exhausted, someone pushes a particular emotional button, and we can flip our lids. So rather than being tuned in and connected and balanced and flexible, we can lose all of that flexibility, even lose moral reasoning, and act in ways that are terrifying to others, including our children. Now, you can actually bring yourself back online and come back to the high road and make a repair with your child. And that's important to explain to them. And you can also use this hand model of the brain to explain to children, even as young as 5 and 6, how to understand when their emotions are rising up from the brainstem and limbic areas here, and how it's overriding the prefrontal area and making it so they may be about to flip their lids. So I've had kids come tell me that they're about to go flip their lids and they need a break. They need a timeout. And by even just naming that, they can tame it. And that's the power of using the hand model for ourselves and our children to help us all make sense of what goes on in the emotional communication that we have in the course of day-to-day life.
Okay, so I think everyone can really appreciate the flipping of the lid, right? And the importance and the significance of trying to get your brain back online. So we'll talk about that, and I'll use the hand model a little bit tonight too to talk about that. So the great part is, even though our cortex can think our amygdala into firing off, our cortex can also tell our amygdala, you were misfiring. There's no danger. That was just you worrying about going to get milk and Cocoa Pebbles. It's not, that's not a lion, right? So you can bring your brain back online, and we're going to talk about some different tools, how, a little bit later. And it's not always easy, right? Like I know I got some of the questions that Gabriella collected from people for this webinar, and it's really clear we're all really struggling. Anyone who's a PANDAS parent is struggling with the level of chronic stress you're dealing with. So this stress response is pretty persistent, right? Like what I'm talking about and your amygdala firing off is pretty significant. It's happening really routinely. And it makes a lot of sense that you're having really big emotions, that your brain might flip and you might get really scared, right? And it's figuring out how we get our brains back online and we slow down. And we have some tools at the end that we can talk about to really help regulate. For me, as a person, really breaking down like what is happening in my body that's causing this is really helpful. And so hopefully it's helpful for you as well. Okay. So this is my funny Sylvester slide. So basically, we're under stress pretty much all the time. You all, I'm going to guess, are feeling pretty overwhelmed on a regular basis. Our children's needs are pretty acute. And of course, this is a spectrum disorder. So some may not be as significantly challenged as others. But regardless, I also just want to say it's your experience is relative to you, right? So it's stressful for you. You don't need to say, well, one person has it worse than the other person. Like, no, this is actually pretty significant. And your body is kind of under siege with this limbic system constantly firing off, right? And I just always remind people that it's really relative to your experience. You don't live someone else's life, you live yours. And for you, it's really significant. So what we know about House is really actually the perfect meme for all of us here. I don't know if you guys watch House, but it's the medical mystery show. So anxiety is mostly about avoidance, right? Like we will do anything. And everyone on this call, there's probably very few people that are on this call that wouldn't acknowledge they would do anything to not feel bad, to not feel stressed, to not feel anxious about their child and their child's physical well-being. So anxiety, you want to avoid that feeling. And what you really want to do is find some sort of locus of control so that you feel better, which is not necessarily the best plan for anxiety, but it's what we all do because this limbic system firing up and all those stress hormones in our body just simply don't feel well. And the reality is when it comes to our kids, we're going to pretty much do anything for them. And so this is where the struggle really comes in when anxiety and trauma are dominating, right? So we want to figure out some tools and really understand and break down what's happening for us. Okay. So I love this slide. It's a really great one for trauma, actually. And it talks about how the brain and the body remember. So when we have this really acute stress response and our limbic system fires up, right? We actually map down the response because our brains and our bodies are amazing. They are really there to protect us. And our brain is really trying to take care of us and say, I'm going to remember what that stress was. I'm going to remember what that lion was so that I can tell you the next time so that you can get away quicker, right? So what happens is your brain is like this great big cornfield, right? And if you walk through a cornfield once, the grass tamps down and then it comes back up, right? So you might walk through once and you don't even see where you walk through. But if it keeps happening over and over and over, you're going to wear a path through the grass, right? You're going to be able to see it. And that's kind of what's happening for all of us. When we have these stress responses and our limbic system fires up, we start to wear a path there, I work with Peggy Chapman quite a bit. Some of you probably know Peggy, right? And she'll talk about like superhighways in our brain. And that's what this is. We're creating almost these little superhighways of neuropathways because neurons that fire together, wire together. And they kind of develop these paths. So when our brains fire up, they remember why, and they remember that we told our brain that this is a lion, right? And it creates this pathway. The great part is it's grass. It's actually not asphalt. We're going to talk about that a little bit later, but we can change it. So I'm not sure if people know Bessel van der Kolk. I actually really like him. I have his book right here. Here it is, Body Keeps Score. It's a great book. So being traumatized means you continuing to organize your life as if the trauma were still going on, unchanged and immutable as every new encounter or event is contaminated by the past. So here's the really complex thing about PANDAS, truthfully, is it never kind of seems to end, right? You're kind of, and even when your children start to heal, you are kind of stuck in that place, remember, where that amygdala fired off probably most. And you're kind of stuck in those memories. So trauma is almost like developmentally held, so to speak, even though we're all older, right? In the place it happened. And so you're remembering that place over and over and over, like that neural pathway has been kind of established with that. Your brain is that grass field, right? So you kind of keep going back to that. So the type of anxiety that comes with this type of trauma creates a really unique reaction. So you may feel like you're right back in the crisis place you've been in before, even though you're actually logically not. Like, you may know that, and that has happened to me quite a few times. Even when my kids have gotten better, I automatically go back to that place of like, oh my gosh, this is awful. Like Chicken Little and the sky's falling. It's all awful. Nothing's good. It can make it really hard when our children do start to heal, because we're still stuck, but they're healing. We're always waiting for the other shoe to drop. The sawtooth recovery of this illness only compounds it, because we have one step forward and 5 steps back. And we may not be able to acknowledge how far they've come, because we are kind of living in a perpetual state of stress and fear and panic. Okay. All right, so that's kind of the neuroscience part of things. And I've spent a lot of time, I do know a lot about trauma, and then I got a deep dive into anxiety, obviously, well, with my own kids, right? And kind of watching what's happening to them. And I really wanted to peel back the layers on like, why is this so complicated? Because sometimes my stress responses shock me, to be honest. I feel like I've been doing this a long time, and I have a lot of, if I don't have self-awareness, I have friends that will help me remember what's happening. But overall, I've done a lot of work. I've done a lot of reading and research to understand, like, why is this illness so hard for us? And so I've kind of put together some ideas of kind of why I think it's more challenging. The illness inherently comes with mental health stigma. I know we're in 2022, and we can say that mental health stigma is not a thing. I would disagree, as someone who deals in mental health pretty much all day. I think it's really significant. I think, especially once, I know for me, once I found out that there were medical roots, because I didn't know for, most of my children's childhood. I didn't learn about PANDAS until my son was 11 and my daughter was 13. So that made it so, we had kind of lived in this bubble of this has to be mental illness. And now I learned it was actually medical. And I'll be honest with you, I want to run away from the mental health part of it. I really did, because I wanted my kids to be fixed with medical interventions. And the really hard part is it's actually both and. You're going to cure the body, but remember, we just talked all about this limbic system, neurons that fire together, wire together, and our kids have similar brains to what's happening for us, mapped down differently. And so, it is actually both and, which is really hard, but mental health stigma really makes it hard to kind of accept and talk about a million other things. So I have this great clip that I use actually to train. I do a whole caregiver trauma and stress training for districts and for other educators and other professionals. And I really like this clip. I use it often. And I think it will probably resonate with you all. So I'm going to play it for you.
Overtime editor Ann Silvio talks with Scott Pelley.
Scott, your story on 60 Minutes this week is about mental illness in children. Where did this story start for you?
Well, after Newtown and the terrible events that occurred there, many of us at 60 Minutes began to ask the questions, okay, how does this happen? One of the things that we discovered is that when parents have a disturbed child at home, it is very difficult for those parents to find health care for their children in this country. The first place these kids tend to present themselves is the emergency room when they've had a complete breakdown and they are violent and a danger to themselves or others.
You arrived on the scene, was she out of control at all?
Yes. We went to the Yale New Haven Hospital. They have 52 beds at the hospital for psychiatric patients. They're generally full all the time.
I'll tell you what we got.
How do they come into the emergency department?
Usually it's in an ambulance, police officers may be accompanying them. Parents do bring them in. Sometimes teachers bring them in from school. But usually the scenario is, 911 is called.
Have you ever been hospitalized psychiatrically?
Yes.
And why were you hospitalized?
Overdose.
Were you trying to kill yourself?
Yes. When these kids come into the emergency department, there's literally no place for them to go.
So they just get sent home?
They get stabilized is what they call it. And so these parents tell us that it's just a revolving door through that emergency department, that they have to go back again and again and again.
He was discharged and on a Thursday, and we were back on Sunday morning.
Our producers on this segment, Michael Ray and Oriana Zill, have been working on this story for many, many months. And the really difficult part is to get anyone to come on to television to talk about it. Imagine being a parent, appearing on 60 Minutes to talk about the serious mental illness of your child. Very hard to do.
This has always been our only option.
The emergency room.
Emergency room, yeah.
I think we spoke to probably between 30 and 40 families.
A large percentage of parents said no. I don't want anything to do with this, and please don't film me.
Oriana and I are both parents of young children. I mean, we all have kids who have freakouts. They want something, they yell, they scream.
Temper tantrum.
Temper tantrums. This is something that goes well beyond that.
How is this different?
I can tell you a story. My son got mad at us for something. I can't even remember what it was. And I found him that night hanging out of our second story window by one hand because he was so angry he was going to kill himself. He was in 5th grade.
It's the intensity and the severity of the symptoms. These are kids who are persistently and severely violent, out of control, threatening to kill their teachers, punching, kicking, biting, scratching, flipping desks in the classroom.
We went to one home where literally the entire living room was filled with holes in the wall from the child punching the wall. And there was one that was a very large hole. And we said, what happened there? And she said, the mother said, well, that's where my son threw his brother through the drywall.
And this is a story that we don't tell because it's shocking. We tell because it's common. It's all around us. And we were surprised by that. A lot of people keep it in, they keep it quiet. There's shame attached. Everybody talks about the stigma attached with mental health, and it's real. It's really real.
What is the difference between being the mother of a child who has mental illness and the mother of a child who might have heart disease or cancer?
Sympathy, empathy, empathy,
Understand.
casseroles.
Casserole. What do you need?
Somebody needs to share the casserole story.
My daughter, when she was 13, was hit by a car and fortunately was fine except for a very bad broken leg. The church organized a brigade of, casserole makers. The neighbors brought casseroles, friends, families, everybody. 6 months before that, Christina had spent 2 months on a psychiatric ward, and we had no casseroles. And I'm not blaming the church or the neighbors or anything because of the stigma, and we didn't tell people.
One woman had a violently mentally ill child at home, and her neighbors had a lawyer send her a letter to remind her that it was her responsibility to seek health care for that child. It's that kind of difference. If
So
a
instead
child,
of a casserole, you get
you get a demand letter from a lawyer. Yeah, there's a fear, of course, not entirely unjustified, as we've seen, but there is a fear of mentally ill people.
If you do feel like killing yourself, what kind of thoughts do you have?
What resources do we have for parents with mentally ill children to make sure that that child has the opportunity to be better and to not go off the deep end? After Newtown, after any of these school shootings, we always ask, why did this happen? How could this have happened? How did this crazy person get a gun? Reasonable people will disagree about gun control. But when you hear the story of these parents and the struggle they have with their children, I think most people would agree we can do a lot better job on the mental health care problem.
So I'm not sure how many people got casseroles. I never have. So I just really love that clip because I truthfully think in a lot of ways, when I really break down PANDAS, I think what's really hard is talking about the mental health symptoms. And what's really hard is acknowledging that our children are impacted in a mental health capacity. They just are because of the neuroimmune issues that they face, right? And I think when I didn't know that it was PANDAS, it was much harder for me to advocate in a lot of ways. I felt less sure of myself. I felt really judged. I mean, I think we can all say we probably still feel judged, to be honest. But we had a lot of support in the house and we didn't have people coming to check on us. And after we found out it was PANDAS, and I would go talk to people and I would say, we were doing everything we could to try to help our kids. And they would say, well, we thought it was a private matter. They may have seen the ambulances come to the house or the fire trucks here and no one asked, right? And so I think for us as a community, really kind of being able to acknowledge the mental health piece of this is really impactful. So I just kind of like to talk about stigma a little bit because I truthfully think stigma is what's getting in our way of getting this really solved and getting a lot more attention. So, okay. So another kind of barrier is just the history of how we view mothers and caregivers globally, right? We don't have a great history with how we view parents. So, Peggy Chapman will often talk about, I'm sure a lot of you have heard her talk about kind of the progression of in mental health, how we viewed parents, right? So you have schizophrenic mothers. Those were mothers who were causing their children to have schizophrenia, refrigerator mothers who were the mothers causing their children to have autism. We now, I'm sure all of you kind of live in fear of being called a Munchausen by proxy mom or dad. Controlling moms. We have a history when we don't know something or professionals don't really have an answer, we try to find an answer. It's human behavior. It's just what we're wired to do. And so if you look back in the history, and I've read a couple of great books, there's a great book called Mind Fixers. There's also another one called Madness on the Couch, which really details our history with kind of these beliefs that caregivers may be to blame for their children's issues. I'm sure anyone who showed up at an ER or when their kids aren't getting better, it's kind of an easy place to go. A lot of people just default to, well, what's happening in the home? And there could be things happening in the home for sure. We all have kind of our own struggles, right? But I think an easy default oftentimes is there something happening? Did someone do something, right? And so the great part about some of these stories, like the schizophrenic mothers, the refrigerator mothers, they weren't really a thing, by the way, so I don't even like to use that term, but parent groups really rose up and demanded change, right? So NAMI, which is the National, I think, National Alliance of Mental Illness, those parents in the 1980s banded together and said, that's enough. Like, this is enough. Our children with schizophrenia actually have medical underpinnings. This is organic mental illness, and we need cures. We need you. We're demanding change. Like, you don't get to just blame us. We didn't cause this. And the research pans that out. It's not caused by parents. And that's actually how we started to get psychotropic meds in the 80s, that psychiatrists were really starting to prescribe them. So it's just really kind of good to note that when parents band together and demand change, change happens. And so that's what we're all going to do, right? To really make this an easier place for all of us. Medical gaslighting, for sure. We know sometimes the medical community is not fully bought in and doesn't always understand what's happening. And I think the medical community has kind of developed, oftentimes, if you go to the pediatrician and you have a child with anxiety or depression, they're kind of automatically, turfing you to a mental health person, right? There's that kind of real clear delineation and separation in the two systems. And so I do want to remind everyone that we have federal mental health parity laws, which actually demand equality between mental health and medical. And we're in 2022, so we're going to start to demand that these separations really just aren't reasonable. And I just learned today that gaslighting just became Merriam-Webster's dictionary's word of the year. So that's interesting. And then we have kind of barriers around just socioeconomic barriers. Like, this is a really expensive illness to treat. I'm sure all of you know that. And do you have insurance? Do you even have a car to get to the hospital if you had to get there? Can you find treaters in network? In Massachusetts, treaters are pretty hard to come by. So can you afford the medication? It's really painful for parents. And this all complicates complex trauma. That's why I'm kind of talking about all of these, to kind of highlight all of the stressors you all are facing. If you have socioeconomic barriers, this is really challenging to try to access care, right? And it shouldn't be that way, because we know that, and that's why we're all advocating and kind of fighting for mental health parity and equal access, and folks to really understand it from a medical perspective. I also just wanted to put in systemic racism here, because I feel like it's something that's not talked about, but if I would imagine for BIPOC or Latinx families who are diagnosed with PANDAS, it becomes that much more complicated with just the general distrust of medical community, and the systemic racism inherent in it. And then the lack of access and kind of distrust of, the mental health system at different points. There are some really good statistics that say Black and Hispanic children are 14 less likely than white youth to receive treatment for their depression. And in 2018, a study found the suicide rate for Black children between the ages of 5 to 12 was nearly twice that of white children. So anyway, it's just, those are additional barriers for folks. Okay. So all of us have to learn these new languages. Like, you just got thrown in, your child may have had an acute onset of symptoms that are incredibly stressful. And now you have to learn to navigate these three big systems typically, right? So you have the mental health system. I'll tell you, the system's totally overwhelmed. So even if you were trying to access it, we have families boarding in ERs for up to a month. Staffing is struggling right now. The mental health system also is not well staffed. The hospitals are not well staffed. It's not super intuitive to access supports in this system. I think the crisis intervention is really challenging for caregivers to access, and you may not want to, because again, your child needs medical interventions, and the psychiatric hospitals actually will mainly only do psychotropic medications. The psychotropic medications can take a long time to work, and they aren't always great fits, right? And the mental health system really is not online to truly understand PANDAS right now. So I think it's really challenging, especially if you are a PANS parent like me, and you had children that you perceived were mentally ill for a long time. And now you just learned that there's some medical underpinnings, and making that shift is really hard. It's a challenging shift because in the mental health system, we're really trained to kind of have almost automatic access to psychiatrists, right? Like if you have a psychiatrist, you can call in a crisis and you may say, you know, Susie is really struggling tonight. She's having really intrusive thoughts and suicidality. And the psychiatrist may say, well, I'm going to change this, right? I'm going to change this med. And you kind of have almost like a false sense. Maybe it's not false. Maybe it's true. For me, it was often false that the medication didn't really work in expected ways. And so you kind of get into this system where you think if you change something, things are going to change. For me, I don't know, for our kids, it didn't work that well, the psychotropic medication. But at least you feel like you have a locus of control in the mental health world because someone's going to pick up the phone because you're in crisis, right? And then when you move to the medical model, it's just not the same, right? Because this is the long game in the medical world, right? It's really hard to kind of navigate all of these systems. So the medical system, the generational view of doctors just makes it really hard to oppose them. I don't know about you all. I literally had to go find a new primary care recently because I didn't feel like I was being heard. And it was really hard for me to change doctors. I don't know why. I'm a grown woman. It's really hard to say to a doctor, you know, you might be wrong. Or I have a different viewpoint, or you're not listening to me. Many parents are used to doctors being the experts, right? But few are very knowledgeable about this illness. Our specialists are siloed. They're not consulting each other. That makes it, you all end up being de facto caseworkers, right? And we're all often the experts on our children. And, you know, medicine doesn't always value parent experience. I was fortunate enough to be asked to speak at Georgetown Medical to a group of doctors on caregiver trauma. And they were really receptive. I don't think it's the norm that they kind of get that feedback regularly. But the young doctors were really receptive if we can get in and get to them. And then you have the special education system. It's just not really super well understood. Again, parents are experts on their child, but maybe they're not asked, or the school system may not understand. IEP meetings can be super overwhelming and traumatizing in and of themselves, to be honest. And I'll just pause here and say, I think it's really important to note that schools have pretty significant federal legislation that they're mandated to follow. So like child fine laws, and it's their job to identify students at risk. So if for some reason your PANS child can't go to school because they're medically compromised, it's a challenge, right? Because schools have to go looking for kids and they're going to wonder, why is this child not in school? So it's really important to kind of be upfront, explain what's happening, talk about it. Aspire has some great resources, like pamphlets and brochures to really help school systems understand. And I will tell you, I'm getting a lot of systems and schools reaching out to me to say, can you talk to me? I just need to understand more about PANDAS. I have, 2 or 3 kids, and educators really want to do the right thing by kids. So the hope is if we can kind of keep educating them, they'll understand. But it's definitely a whole different system with all different rules than the mental health system and the medical system. So you guys are doing kind of heroes work. Okay, so grief and loss, to me, I had a realization. It was at some point this year, as I'm kind of walking through, my son is a senior and I'm walking through a lot of lasts, right? And quite frankly, I feel like I was robbed of a lot of firsts, right? That I actually did kind of a deep dive in some reading on grief and loss, because I wonder if it's the grief and loss piece that really confounds all of our ability as PANDAS parents to really move through the trauma, right? You all have experienced so much loss, especially if your child was healthy one day and you lost them the next. That is devastating. Like, I don't think you can put into words what that feels like. So I think, you love them and you may not recognize the child before you, and you had all these hopes and dreams, right? So for me and for my family, my children had to leave their community schools and go to therapeutic day schools. That was wonderful for them, super healing. It was great in many ways. And it was a huge loss because we all had to give up kind of community activities and being part of the community. And you just felt different and othered. You may have friends who leave, you may have family that leave. It's a really complicated loss, and it's still a loss, right? Like the loss of community, the loss of school community, loss of neighborhood, loss of friend groups, loss of connections. It's a super isolating illness. So I just kind of want to name for everyone how challenging, and I actually think this really complicates it. I could name a million different kind of sporting events, right, that I've been to, and I still feel, I think the anxiety and the stress and the trauma of this illness also just make you perceive the world differently. And I forever feel different, and that's just how it is when I walk into a football game with my kids, or it's really hard. There's a lot of, my husband will be looking through pictures, and it's really hard. There's a whole chunk of time that I look at pictures and I can see their eyes aren't right? You guys probably have this too, or you probably all have the videos. Many of us have videos, right, that we have of our children because we can't comprehend what's happening. So we take videos to show people, right? And, it's really hard to look back on those times. It's really painful. And so there are large chunks of time that we don't have pictures up in our house of them, or it's just devastating. There's a lot of grief and loss, and I do think it complicates things. And so this is just like the impact to the relationships, right? Like it is really significant. So here I just want to name you and your partner, if you have a partner in your house, if you're fortunate enough to have a partner, because I definitely have friends who are single parents and it is devastatingly hard for them. If you have a partner, you may have incongruent stress reactions. I know myself and my partner do. So you may be a scrappy fighter and kind of working to kind of control and make sure that everything happens. You may be the organizer, right? Like you have all the medical appointments, you have all the mental health appointments, you've got everything down pat, and your partner may be the freezer and they're really struggling. And it doesn't mean they don't care. You may perceive that because you're moving 1,000,000 miles an hour. That's me, PS. And your partner is frozen in fear, right? Because they're just scared. So you have incongruent stress reactions, which makes it really hard to figure out how to parent this really unpredictable child sometimes, right? Single parents, it's just a huge struggle, just all around. It's really hard. It still presents as mental illness. So, like I talked about with the stigma, your friends and family don't understand the prolonged nature of the illness. And this is where I go back to the grief and loss. If you read books on grief and loss, it really talks about how our human nature is, we want everything to be okay. So this is not necessarily an actual death, right? This is your child is still living and yet you've lost them. But people struggle with tolerating pain, right? And sitting in other people's pain. And so people want you to move on. People want you to be okay. So even if you decide you're going to go out with your friends, you may be less willing to share it because it's an invisible illness, which makes it harder. And B, people really struggle sitting in other people's pain. And you're probably in pain a lot of the time because this is so complex. The intense separation anxiety that comes with it should not be minimized. You may be enmeshed with your children. They're dependent on you in ways that are really unique to PANDAS. They really need you. I'll never forget a clinician, and remember, I'm a mental health professional, so I think I've got this down, right, when I'm trying to get them better. And I was always floored by other people's insights of what was happening, because trauma and anxiety and stress actually kind of makes you blind sometimes. It makes you lose perspective. Anxiety is a really myopic kind of thing to happen to you, right? You're really hyper-focused. If you're running from a lion, you are hyper-focused on what's happening with you. You're not really peripherally paying great attention. So you might miss what's actually happening, right? So for me, I had a provider say to me once, you know, you're part of your daughter's OCD now, right? You're the C in her OCD. And I was like, wait, what? What did you just say to me? And that was really painful and not what I expected at all, that I had kind of become part of this because of the intensity of the separation anxiety, because they need you so badly. It's really painful. The sawtooth recovery makes it really hard. If your child is doing well and has a flare, it's just catastrophic. I mean, the stress reaction, when that happens, and some people who are on here, some of my friends who are on here have gotten calls from me when this happens, it's almost like, I call it, you go into like a trauma fugue state where you literally can't even remember what's happening because you're so stressed that like your child's gone again. And where did they go? And we don't have a lot of great material and understanding of like, because this is brain trauma, just to name it. And we don't know how the brain heals. And so how we don't have these great rubrics that we're all following. We're kind of crowdsourcing a lot of our care, to be honest, and working with each other. Like I'll call someone and say, what worked, you know? I mean, I have great treaters, but it's really, really complicated. So if your child is doing well and they have a flare, the stress reaction can feel really intense. My husband's getting food for the dog. Sorry. Thanks, man. That's great. I have a sign on the door not to come in, but you know, that's okay. No one's listening. Okay. So I figured my son would be in here asking for his Cocoa Pebbles, but he's not. So the behaviors, I talk a lot about this to parents. They're pretty surreal. They're like nothing I have ever encountered. Remember, I worked in residential treatment centers with really acutely traumatized teenage girls, actually. So I pretty much seen every behavior you can think of. And I really felt like I knew behavior management, and I knew what to do, if that makes sense. And all the rules flew out the window pretty quickly when we were trying to manage the behavior. So it's just not behavior that you manage in typical methods. You may be trying to keep a child out of another ambulance ride or another psych hold, knowing that, you know, once they kind of regulate and get out of their OCD rage, they'll be fine. I can't tell you how many times that kind of happened for us, that like, we just needed to ride it out and then they'd be okay on the other end. When my daughter was really struggling, we would do everything we could to support. And she was able to verbalize that when she was given an expectation, she knew she should follow it. But her brain would actually tell her she shouldn't listen, and her body would not respond. So the way she described it, which was really interesting later in her teenage years, was that there is actually, it was almost like she was sitting in the back of her brain watching a movie, and she could see what was happening, but her body wouldn't move. So she, you know, it may have looked like she was refusing to engage in whatever expectation we were giving her, and really her body just wouldn't respond. So I feel like the behaviors can be really unexpected, really incongruent with your family norms and values. You might get a lot of feedback from other people about them. So all of these things just complicate your trauma response. Okay. So what can we do to help ourselves? Well, hopefully there are a lot of things. I'll just try to give you some tools that I find to be helpful and that have historically been helpful for parents, students, clients that I've worked with. So we're going to start with Dr. van der Kolk again, who I really like. If an organism is stuck in survival mode, its energies are focused on fighting off unseen enemies, which leaves no room for nurture, care, or love. For us humans, it means as long as the mind is defending itself against invisible assaults, our closest bonds are threatened, along with our ability to imagine, play, learn, and pay attention to other people's needs. So again, we are really stuck every day in this stress response, many of us, over and over and over and over, right? And it's really important to know that it doesn't have to be like this. I mean, it sort of has to be like this because our kids are really sick, but you deserve to feel better, and feeling better. And by feeling better, you'll have more access to this thinking brain available to support your child. So the times I've been most scared and stressed, I'm least likely able to guide my children, right? I'm acting from this really impulsive, this amygdala has fired off and I'm like, I got to fix it. I got to fix it right now, right now, right now. Oh my gosh, stop it. I can't do this again. There's no way I have the energy to go back to what it was, right? Because remember, trauma is telling us we're back in that fixed state. Even if our kids are better, we automatically go back to that. So I have a great example that I often use, and I've shared before with others that my daughter advocated to go back to her public school when she started to feel better. And this was huge. I'm a huge proponent of going back to public school if you start to feel better. But we really loved the school she was at. I felt safe, I felt heard and taken care of, and like people loved us. And I was just terrified. And I had a reaction that I couldn't explain. I got to the IEP meeting. My daughter was so poised. She advocated for herself, and her mother sat in a corner and literally cried. Just openly wept the entire time. And I couldn't figure it out because I was supporting her. I wanted her to do it. It was the right decision. And yet emotionally, like I just, all those emotions welled up. I was so scared. Oh my gosh, what happens if we go back and she has a stress response? I don't know how I'll survive it. Like, I just want everything to just stay small and calm. And that's actually not the way through anxiety. Like my daughter was doing the right thing and I was stuck and frozen back in time, right? And even when I had to walk through the process of like signing paperwork and handing the paperwork in, I could literally feel like I was walking through sludge. Like I am not an avoidant person, to be honest. So I remember taking note, like, oh, I think this is a trauma reaction, because I literally want to pill bug, curl into a ball and roll under my living room sofa. And I had to use other people to kind of help me get through it, because I was like, I don't think I'm going to sign this paperwork. I don't have to. So here we are back. Your brain is like a field of grass. It's not asphalt. You have these mapped down learned responses, right? But they can change. It's not easy. I'd be lying if I said it was easy, but you can change. You can change the behavior. You can change your response. Because as amazing as it is that our bodies have this amazing limbic system that keeps us from danger, and our cortex that thinks about it, and our frontal lobe that plans for it, we also have the ability to reprogram our brains. Our brains have neuroplasticity, so they can change. You can carve out new pathways. You can strengthen these pathways with good habits. And the old pathways get used less and they get weakened, right? So it's really important to know, and here's my hope, that's my rainbow. Our brains have what's called neuroplasticity, so we can change them. So even though we have this really complicated profile, all of us, right? Like you have all of these barriers. You have this really complex trauma response, and complex trauma is really just this kind of sustained, prolonged fear-based state, which all of you are in. I'm not telling you what you're in. I'm assuming if you're on here that you have an understanding, right, of that piece. And it's a really complicated illness to kind of try to walk through, but our brains can change, which is really amazing. So I really like talking about the fact that it's actually not healthy, that this keeps firing. So we can't just acquiesce to it. We can't say like, well, I don't know. It just is what it is. You know, I'm just in this stress response. I'm so scared all the time. Yes, that's true. But there's research to indicate that these hormones that are being kind of funneled out. There's some great research. It's called the adverse childhood experience. Research out of Stanford, you can Google it and you'll see they did longitudinal studies on children who had adverse childhood experiences or traumatic experiences, right, that children may have had. And they followed a group of kids into adulthood. And children with 4 or 5 ACEs, 4 or more ACEs, had really acute autoimmune and heart disease, really significant health issues. And we all in the PANDAS community, truthfully, we know why that is, because the immune system, it actually talks to the nervous system. And when the nervous system fires up, the immune system thinks it has to get ready because you might be eaten by a lion. That's what you're telling your body. And so it sends out cytokines and all of this just disrupts our immune system, right? And it just leads to long-term autoimmune issues and health dysfunction. So trauma, and all of the trauma therapists, including Bessel van der Kolk, Stephen Porges, Peter Levine, they've all pretty much, they are kind of one step away from tying it all together that trauma is a trigger for the immune system to be kind of unhinged. Your brain learns a way of responding and it maps down the response, like we talked about. Neurons that fire together, wire together. You feel perpetually unsafe when you're stuck with your amygdala firing off. That's not fair to you. You're actually really worthy of feeling better. Like no one should feel that bad all the time. And I know that in a lot of ways, having anxiety actually kind of probably keeps most of us going, truthfully. And this amygdala firing up makes it possible for us to kind of do all the things we need to do for our kids. And we have to take care of our body, to be honest. I need to stay healthy for my kids. So I'm really mindful that like, I've got to figure out how to rein in this stress response because they deserve a healthy mom and they deserve kind of an intact mom, right? So I always do a little shame piece when I talk about anxiety. All of us here have to stay out of shame and be kind to ourselves. This illness, in my opinion, is steeped in shame. These are our precious little bunnies, and we can't figure out how to help them a lot of times, right? This is a complex illness. It absolutely has to do with the body. It is immune-based, but it is neuroimmune, and that means the brain is impacted as well. It just is. Our children's brains have been wired for that anxiety, and we have to help them rewire it. It's both and. So I think in order to achieve true healing, we kind of have to understand that piece. And it's really, really challenging. So we often sit helplessly, right? Like when your child is having intrusive thoughts and you're sitting there, you can't fix it, right? Like you're scrambling to call doctors and figure out what medication can you put on. It's awful to listen to your child in pain. And then they may not tell you. Some of you may have kids who aren't even talking about it, right? And you know they're trapped in their brains with these really awful thoughts. And it's figuring out, it's so shameful to figure out, like, I am the parent and I can't figure out how to help my own child. Like, that's horrifying. And then there's the shame of like, these behaviors are so incongruent. These aren't my norms and values. Like I don't teach my child to say those things. Your child may have Tourette's, right? Like you don't teach them those words, right? Brene Brown, who I often say is my friend, says that shame is the intensely painful feeling that we are unworthy of love and belonging, right? And so the shame of what's happening often complicates things and really makes it hard for us to move through it. Shame actually has the same trigger. It's the amygdala firing off. If anyone's ever felt shame, it's actually more significant than the anxiety response. It's really significant, right? Shame is firing off from the same spot in your brain that stress response and the trauma comes from. So Brene, like I say, she's my friend. She's not, I've never met her, but I'd really like to. Brene would say that shame is so painful for, I'm going to insert us as adults, because it's inextricably linked to the fear of being unlovable. And being unlovable is a threat to survival. It's actually trauma. So I'm just going to play a little clip from her to talk about this, because I think shame is so important and really important that we understand it so that we stop shaming ourselves and we start giving ourselves a lot of kindness.
Yeah. No, the 1, 2, 3 is about shame. We all have it. It's the most human, primitive emotion that we experience.
How do you define it?
The intensely painful feeling that we are unworthy of love and belonging.
And
The
does it
devil.
occur after a particular incident, or does it occur over, many life experiences?
Both.
Both.
It could happen in an instant. There are specific memories that we can recall that can bring up shame for us. But there are also very insidious, quiet messages that we just marinate in over a lifetime.
Okay. How many of you have quiet, insidious messages that you kind of ruminate on, right? About the shame around this illness? Like a lot of us can say that. Okay, I'm going to start again at 3.
Secrecy, silence, and judgment.
Yeah.
So you put shame in a petri dish.
Yeah.
And you douse it with a little secrecy, a little silence, and a little judgment. It grows exponentially. It will creep into every corner and crevice of your life.
And shape all of your...
Shape everything.
Shape everything. The way you think, the way you think about yourself, the way you think about other people, the way you interact with other people, what you do, the choices you make, who you marry, all of it.
Yeah. You put the same amount of shame in a petri dish and you douse it with empathy.
Mm-hmm.
You've created an environment that is hostile to shame. Shame cannot survive being spoken. It cannot survive empathy. So if I call you, if something really shaming happens to me.
Okay, wait, I'm stopping. Okay. So the importance of us having empathy for ourselves, because truthfully, the amount of empathy you have for everyone else, for your children, for other people, I'm going to guess, and I'm just making up a story because some of you may be like, I don't feel this way at all, but the self-talk you give yourself is really important, and being kind to yourself. You are doing everything you can to help your children, right? So here are some great attributes of empathy. Perspective taking, which is really hard. Remember, when your amygdala is firing off, it's really hard to have perspective taking because you're running from a lion, okay? You're going to stay out of judgment of yourself. You're going to recognize what's happening in your body, which is really hard because it's happening quickly, right? That amygdala is firing off and the brainstem is having emotions. It's like figuring out what is happening in your body. You're going to communicate it. This illness is so isolating. We're going to talk about that in a little bit, but we need other people. We need other people to have empathy for us. And we need to find our people in our tribe. And mindfulness, which is really hard. It's particularly hard for me, if I'm being really honest, to really slow down and kind of have quiet moments of reflection. So we really need to practice radical empathy and radical acceptance. We are all doing the very best we can. Our child on any given day is doing the best they can. You have to kind of find pockets of light and hope as you move through your day and allow yourself those small moments of joy. I think what I found is this took me a long time to figure this out. And it often, truthfully, if I think back on it, it actually took, I call them the hit your knees moments. Those are kind of the moments that I'm on my knees and I forgot that what happened? How did I get here again? Right. It almost took me being so scared and not knowing what to do before, because I'm pretty stubborn, I'm not gonna lie, before I was able to ask for help and say like, I don't know what's happening. I need help. Like, I can't do this on my own. It's just too much for me. And really just kind of radically accept, like, I'm doing everything I can and I'm not moving the needle. I need more help. I need to think differently. And I worry all the time. You know, we all worry. This is kind of part of this illness, is we almost become hardwired with this amygdala, right? The words we use with ourselves really matter. Like, I shouldn't be scared. So many people have it worse than I do. Remember the it's all relative thing. If I just worked harder, I could help them. This is all my fault. Like, we need to change the narrative. We need to be kinder to how we speak to ourselves. And that seems like simple, stupid, to be honest. But it's really hard. Because you're also kind of stuck in this stress cycle and this kind of perseverative worry about, like, how am I going to fix it? And what am I going to do next? You really want to identify what your stress response is and just own it, whatever it is, right? It's going to determine how you move through treatment for your child. And if I can offer some advice, having, you know, been through this, and honestly, I've been all of these, you know, different responses at any given time. For the fighters, like, we want to fix it right away. We're big into, like, what's the next step to kind of fix it. And I just want to remind you that this is the long game. That's the most painful. This is a marathon. It's not a sprint, right? And it's figuring out how you can slow down enough to kind of have enough clarity to see the next step. Like, I always think of it as, like, I'm looking at my feet. I need to take the next step. If I look up, I'm going to fall over, quite frankly, because it's too stressful. So I need to take the next step and try to slow myself down. The freezers and the flighters, you know, you may struggle just to trust yourself and trust your gut. Like, either you feel stuck and totally avoidant. I've been there. It may be hard to take the next step in kind of treatment, and your child's behavior just might be really unexpected. You just want to avoid it. It's just so scary and hard, right? But learning the stress response will be important, because we do want to name it to tame it. We want to understand that there's a physiological root to the anxiety and really ground ourselves in this. Like, this is happening because my body's trying to take care of me. It's doing the best it can. It's definitely misfiring a lot of the time. We acknowledge the anxiety and talk about it. And truthfully, like, we wonder, our children have neuroimmune issues. It actually stands to reason. Like, I know for myself, I've done a deep dive on my own health and well-being, because if I have 2 children with this, like, I have to wonder if I have neuroimmune issues too, right? And I have to wonder if some of this anxiety is actually partly neuroimmune. And by the way, just as a reminder, trauma is a immune dysregulator. So you just want to take care of yourself, right? And if there's any chance that some of that anxiety is neuroinflammation from chronic stress and trauma, you want to, you know, try to see if you can't support yourself in feeling better too, right? Because you deserve that. You're really worthy of that. So I don't know if people know Lynn Lyons. I like Lynn Lyons a lot. She talks about anxiety as a cult leader. She does some great parent trainings, like your CPAC, your local CPAC, Special Ed Parent Advisory Council, might have her on deck to help sometimes. So I'm just going to play a small little clip of, you know, she talks a lot about not accommodating the anxiety, rather stepping into the discomfort. That's how we rewire our brains, which for us, it's really hard. For PANDAS parents, because the trauma makes it almost automatic. Like, you get so stressed, it like happens almost automatically, and you have to figure out how to like get some space and distance from, and like take a beat before you react. But I think she just kind of has an important message that I want to play for you guys.
Right, you want that cigarette? You jump in the car. Third thing is, we're going to experiment. We're going to step in on purpose, because here's what we want to do. Say you start to get anxious, right? So there's something that triggers you. Interesting research on trigger warnings too, by the way. not so helpful. So up comes the fear, the anxiety, right? And it gets bigger and bigger and bigger. And then you say, okay, so I got to get out of here. I got to avoid. So I'm going to get out, and then boom, you avoid, and whew, immediately you feel better. So we've now cemented that pattern of, oh, I'm gonna feel the anxiety. It's going to be terrible. I'm going to avoid and get out, and I'm going to feel better. And then we might even say, why don't we just try and avoid it altogether? So we never even have to go up here so that we can be here. What we want to do instead is we want to set things up. Again, I cannot emphasize this enough, in a loving, encouraging, supportive way. We're not just shoving them in. That you're going to go into a situation, you're going to feel the worry, you're going to feel it. Yep, we know what it sounds like. Here comes Sam. He's saying what he always says. Some version of blah, 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 and you can't handle it. Some version of this is an emergency. So we're going to get up here. We're going to feel the worry. We're going to feel the worry. Yep, we know what it is. We know what it does. We know why your body is feeling that way. And you're going to hang out here long enough for you to get over the other side and allow it to decrease. That's how people change behavior. That's how people are able to move out of something, right? So say you're trying to quit smoking cigarettes, right? And so you say, all right, I'm going to quit. You wake up in the morning and, oh God, you want that cigarette? You want that cigarette? You jump in the car, you drive to Cumberland Farms at 70 miles an hour, you get the pack of cigarettes, you take a puff. Oh, I immediately feel better, right? Same thing. If we are talking about stopping it, right? Oh, here comes the craving. Here it comes. I'm going to hang out with it, and then it will subside. I had a client a few.
Okay. So the idea is, in order to make new paths in that grass field, in that cornfield, we have to do really hard things. We have to step into the discomfort, which may mean that you are pausing before acting, or pausing before making a decision. For me, I'll be honest, it is pausing before sending the email. Because I get really anxious, I get stressed, and I want to communicate out what's happening. And I might just say, I'm just going to take a breath and I'm going to wait. And I'm going to wait and see if it's as much of an emergency as I think it is right now. And oftentimes I still want to send the email, if I'm being really honest. I may not send the 5-paragraph email I had crafted. It may just be a paragraph, because I've kind of I put my thinking brain back on, right? My brain popped. I got really stressed. I put my thinking brain back on. Oh, no.
Welcome to today's present.
Okay. So we're going to externalize the anxiety. And what that means is we're going to hold it out here. It's not part of us. Like, don't make it part of you. It's not who you are. It's the stress of your child being ill, right? Give your stress response a name. I don't know, make it a silly name. Have your kids name it. Quite frankly, my kids know now when I have a stress response. They just do, right? Like, they are much healthier than they used to be. And they know exactly what buttons to push in me to kind of trigger that stress response. And it's predictable. It's learned behavior. Everyone in the house knows it. They know when mom's going to do it, right? They know when I'm going to swoop in and try to fix things and rescue people. And we kind of all joke about it now. Like, there's mom. You okay, mom? I'm not. And stop trying to push my buttons. We're going to acknowledge it to others. We're going to really work hard to have a growth mindset. Like, it's flipping the script in the narrative and describing a way of viewing challenges and setbacks. So people have a growth mindset. They really believe things can get better. Even if they struggle with certain skills, their abilities aren't set in stone. Like, we can do really hard things. We can shift our behavior. We can put our brains back online. Do your best to stay in positive self-talk. Use and, not but. My child is very sick and I'm doing the best I can to help them. Things seem really bleak now, and I'm going to ask for help from others. My supervisor at work taught me this, and I really thought a lot about it as I was writing this. And I thought everyone could use a pilot's checklist. So when a pilot takes off, they create a list of do's and don't, creative things to do to practice them, so that in a crisis they can land the plane well. So I have the Hudson River landing. You remember that one? That was a movie where the guy, and he talks about his pilot's checklist, right? So consider making yourself a list to review at the start of every day. Like, what am I going to do to practice keeping myself calm and centered? What am I going to do when I have a predictable stress reaction? You're going to forgive yourself. You're going to be kind to yourself. You're going to tell yourself you're really worthy of feeling better. You're going to practice the list daily. Because remember, when your brain pops and you're in a stress response, you lose your working memory because you don't need to remember how to land a plane when you're running from a lion, right? So you need to practice these skills every day when you're not super stressed. Like, what am I going to do to calm my body? What am I going to do to calm myself? And really kind of having that pilot's checklist and saying, like, they can be mantras, right? Like, you open up your phone and in your notes section, like, you kind of have like, this is how I'm going to walk through my day. Like, when I get stressed, I'm going to remember this mantra and I'm going to open up my phone and I'm going to say it to myself, right? Or I know that I'm going to find moments of joy throughout the day. My friend Brene says that joy is actually the hardest emotion for all of us to experience because we don't allow ourselves to. And I think that really resonates with Pan's parents as well. On your list can be coping skills that fit you best, right? You may exercise. Like, I went for a run before this because truthfully, I was anxious. Like, this was a big presentation for me. I am a PANDAS parent. I'm also a professional. So kind of straddling that can be anxiety provoking sometimes. So I went for a run and that helped me ground myself. You might meditate. I really learned that at some point. Slowing down and sitting quietly was really helpful for me. Call a friend, journal, use some grounding techniques. Like, we use them with our kids sometimes, use them for you. What can you see? What can you smell? What can you taste? What can you hear? Like, those 5 kind of pieces. Is that 5? It's only 4. Well, whatever. You know what I mean? Oftentimes we use like ice to help students kind of get back in their thinking brain and their and regulate. Go get some ice. Like, if you're feeling stressed, like, yeah, this is a really stressful event that's happening to you. Stay off everyone's roller coaster. Stay off your kids' roller coaster. I love this. Someone taught this to me a while ago as well. Like, because they're your children, they are literally little mini yous, externalized. And, and if you're a grandparent parenting, they're still mini yous. If you're a foster parent, you're still caring for someone you love, right? And your instinct is always to get on the roller coaster and ride it with them. And you're going to end up thrown up over the side, right alongside your child. So the best advice I ever got was like, try to remain calm, do whatever you need to do to use your coping skills and stay on the ground. Like, they may be corkscrewing around and you're just wondering curiously what you can do to help when they get off, and how you can help support them. But you get on with them and, it's a lot. I'm not saying you're never going to get on. They're your kids, but it's just a good rule of thumb. Like, I try to reflect and stay curious. Like, what's happening to them? I wonder how I could help best, rather than panicking with them. I also put this on. I'm not sure how relevant it is, but I really like Q-tip. One of my colleagues really likes this. It's quit taking it personally. Of course, we take it personally. These are our children and we love them. And we feel really badly when they're upset with us or when they're frustrated or when we can't help them. But it's just not our fault. It really isn't your fault. This is a horrible illness. It's not, the things they're saying or the things they're doing. It's not personal. It feels so intensely personal. But I just want to remind you, like, the further you can kind of separate and get some distance, which is really hard because remember that separation anxiety makes it really hard to separate, and kind of not taking things that are happening personally, not feeling the shame of it, and really kind of helping yourself move through it. And here we are back at the polyvagal theory chart, and I'm almost done, of a trauma response. This social engagement, this is huge. This is not to be minimized. I will tell you, when my kids were so sick, really in the trenches of it, honestly, I was so isolated. I didn't want to ask for help. That may not have been a great coping skill of mine. I may not have learned that through the years. How do I ask for help from other people? And it was really running the legislation in Massachusetts was probably the first time in a long time that I really got out there and I started to meet other parents. And that was invaluable. And some of those people are on this call tonight and they're like family to me now. And I thought I didn't need anyone's help, to be honest. And I have found the more I ask for help, the more I offer help to other people, the more I find the tools that I need to get my kids better. And the more I find the tools I need to feel better myself. So this social engagement, this is what all the experts say we need, and we do. And I'm going to guess that's hard for some of you. Find a support network. There are support groups out there. Find some professional support if you need it. Other PANDAS caregivers, even if it's just one. And friends who will tell you when you're in your stress response. I literally surround myself by people who will tell me to wake up when I fall asleep. And I do. Like, I hit my knees, something happens with one of my kids, I'm in my, my amygdala fires up and I'm in my stress response and I'm on my knees again. I don't even realize I am. And I need a close friend to say, like, hey, Sheilah, like, you got to get back in your thinking brain. You need to put your lid back on. And I really value those people who will say that to me. So find your network, find your tribe. And then I'm just going to end with this quote. I see your pain and it's big. I also see your courage and it's bigger, and you can do hard things. And I just want to say we can do hard things together. That's actually how we're going to move the needle on advocacy. It's how we're going to move the needle in getting this illness recognized and get us the help that we need, get our kids the help that we need, the research that we need. We're going to link arms together and we're going to take care of each other because we really need each other through this. And that's it. Thank you, everyone, for being here.
That was fantastic. And there were many times I was like, yes. And, I'm looking at all the chat and, basically the main overarching sentiment is that everybody feels very seen and could identify with everything you were talking about, and just making it so clear. Like, I'm going through this. I'm like, yes. And I'm still waiting for my damn casserole. I've been waiting a long time for that thing. Anyway, so, it's like this whole part about, because we always talk about trauma, because it's traumatizing. But your part about the shame, I found to be like really, really for me, one of the most interesting sort of new way of looking at it, because we're always talking about we're like the trauma, but so much of that is shame based, and it's so freaking exhausting. And so, a lot of my day is answering email questions and responding in groups in the Aspire group, and get a lot of emails over the years, whether or not it's been in running autism support groups or the PAN support groups that we run. We hear like, I shoulda, all these shouldas and all these guilts, and guilt and shame are like, bedfellows, right? So, I'm sort of looking at myself like, well, I should have figured that out a long time ago, that it was really the umbrella of shame. Because we can't, it's like, and I always say to parents, like, oh no, you're going to have to skip that. Just like, absolutely skip it. And when I say it, it sometimes comes out like maybe a little harsh, because like, no, you just have to skip it. Cause you can't even entertain it. And, yeah, it's just, and the radical empathy that you have to give yourself. I remember one time I gave a lecture, when I first started lecturing. So I remember one in particular was in Massachusetts at a Lyme conference. I think it was right before COVID. And people were always like, well, how do you deal with the rage and all the symptoms and everything like that? And I was like, that's literally the moment where you just have to radically love them through the entire thing. Like when they're punching that hole through your wall, you're like, I literally repeat like a mantra through the whole thing. I love him. I love him. I love him. I love him.
Yeah.
I hate PANS and strep and Lyme and Bartonella and and psychosocial stress. I love them. I love them. I love them. And I have to do the same thing. We all have to do the same thing for ourselves, right? It's just we have to love ourselves through every moment when we're like, I didn't do anything today. I didn't get anything done. I should have done this. There's always the shouldas, which is the guilt and the shame.
Yep, for sure.
I should have done it better. I should have known. I should have stayed up and watched this thing. I don't deserve sleep. I have to fix my kid. You just have to go, but I'm really tired and I have to love myself, and I have to love myself, and I have to love myself.
Yep. Well, and the interesting thing is I didn't put the anger in there, but we're all, I mean, how do you not feel anger that,
That's
you
part of
know,
the trauma
yeah.
and that loss, that when you were talking about the
Totally.
loss, like really freaking angry through a lot of it. Like,
Yeah.
hugely
And
angry.
I think the big piece is like allowing the feelings to come and move through them. Like I didn't put that on there, but like I think of them as like a tsunami of emotion that comes at you. And you're called to ride the waves, not run away from the waves, not pretend they're not there, like they're there. So feel the feelings, get through it, keep going. It sucks. I mean, it's not fun, but
Yeah, no, none of it's fun. And then when you were talking about, the roller coaster and the at the OCD conference, IOCDF one, there was a really good lecture, and she's a book on, I think it was Sally Winston, on anticipatory anxiety.
yeah.
Like all that steps of avoidance. And it was so great to watch that because Thanksgiving, it's a holiday. We all get stressed at holidays. There's food, there's OCD, there's families, there's that Norman expectation. You're like, you walk into it stressed before you even have to think about burning the turkey, right? And like,
Yeah.
how dry is my breast meat going to be? Like because I was thinking about that anticipatory anxiety with me, who I also have PANDAS. I'm actually not in a flare now, which is a miracle considering I got bit by a tick recently. But, one of my sons with PANDAS came up with something about his teeth. And I was like, oh, it's like anticipatory anxiety happening. And, all of that stress of waiting and that PTSD. So going to the questions, I know there was a question about that. How do parents cope with that hypervigilance and that over analyzing every step and every breath? Like we're like, they breathed wrong. They said that angrily. Like, is this the start of the flare? Like we're always, and
Yep.
One of my PANS friends, we always talk about, we pathologize their entire lives.
Yeah.
And so I try very hard as a mom, as a PANS mom, now that I know that I do this, and we all do this, like to step back and breathe. So I just know what I do, but like, how do you incorporate some of the things that you told us in your tools? What would be a step, like step back and breathe and don't get on that roller coaster?
Yeah. And I think the hypervigilance, it's so hard, right? Like, and I think it's the first step is recognizing it, to be honest, because I think, those hit my knees moments, literally, where I don't even realize it's happening, right? Like it's like an automatic download, like that grass field, you just go, boom, and you are down through that neural pathway, Peggy's super highway, and you're just doing your loops. But the first step is you actually have to recognize it's happening. So if you can't recognize it, I mean, I swear my kids like laugh now. Mom, are you all right? I'm like, I'm not, but it's figuring out how you recognize it, and then you have whatever skills you have, right? There are some, whether it's, I actually like the calm.com app, to be honest, or whatever the Calm app is, like the meditation or the quiet music, or like whatever helps you, going for a run to try to slow down. I mean, I think if you can figure out, I mean, I always think like, I'm not going to make any big decisions when I'm doing that. Do you know what I mean? Because I tend to like, I'll move fast. All of a sudden, like, my son's medication will be like, boom, changed all of a sudden, because I'm hyper vigilant and I figured out that I need to make changes. And what I really needed to do was take a breath and slow down and kind of do the Lynn Lyons, like get over the stress response and figure out, is it really an emergency or am I just panicking? Because you don't want to change all their meds. But like, I think all of us do that because we get so scared, right?
Right. Yeah, absolutely. And then we go into that panic mode, and, some of us completely freeze. Go through all the steps. And one of the things that you think you may need it to help you on this path is to find a therapist. Do you think that therapist has to know all about PANS, and how do you go? Or
I don't. I saw a lot of people actually asked about like CPTSD, which I mean, I'm impressed. Like, I feel like I I know a lot about PTSD. I've worked with it a long time, and this has a different feel to me, if that makes any sense. Like this, and it really is the complex part of it, right? Like we are really, it's almost like we've just been hardwired for this, this response over and over. I don't think, I think for us, the hard part is we want everyone to understand, because that's the human experience. Is like, we want people to, we want to be seen and heard and validated and understood. And I think, and we actually, I think this illness has this really sneaky quality about it where we constantly doubt ourselves because everyone else doubts it, right? So we're like, well, am I making this up? Like, no, you're not. And I don't necessarily think you need someone who understands PANDAS, but you need in your own being to just be okay with that person's going to help me with my trauma response, right? Like I think what might be ideal is going to find someone who understands kind of caretaking. I mean, honestly, like I've even thought about like making a list of therapists who work with caregivers who are dealing with elderly parents or Alzheimer's, you know what I mean? Like that's really what this is you're caretaking, and it's stressful.
Yeah. And someone that has, some background with that grief and trauma and loss and all of that. And
Exactly.
if your thing
For
really
sure.
is shame, then you need to work with a doctor that really understands your shame and how. you
Exactly.
Plus, I found it very, very satisfying to be able to convince my therapist that PANDAS is real. And now she's like, so let's discuss the eating disorder thing. And sometimes we take a moment. And so that was it was very validating for me.
Yeah. No, it's good.
Yeah. Have you found a specific trauma-informed language or DBT tools that have helped partners regroup with managing the wave of PANDAS?
So I think when it comes to like DBT, CBT, ERP, like I think it's all what's best for you. So that's the hardest part. Like truthfully, like this illness is devastating for couples, for partnerships. I mean, because I think when I really drilled into it, I was like, we have very different stress responses. I do not understand what's happening right now. And like I've used IFS, like integrated family systems, which was really helpful. I don't like, so sir, I think it's all about kind of your personality and your style, what works the best, right? Like DBT is distress tolerance. So it can be super effective. And your partner might be like, I'm not doing dialectical behavioral, you know what I mean? So it's kind of finding something that you're mutually going to feel good about. And because it is a huge, complicated family systems issue, and you actually need each other, like you're walking through a war together. That's what it feels like, and that's why I have so much empathy for people who are doing it alone. Like it's awful to have to do it alone. I don't know if I really answered that because I'm not sure I know the answer.
No, you did. I mean, the answer is it depends on what you need, and your spouse or your partner may need something else. So taking that one step further into the family system, what about dealing with the siblings? How do we support them is there a certain type of therapy that they should be doing, or is talk therapy, or what do you
Well,
think?
I think I will say I'm a big fan of IFS. So I am just like, IFS is like parts therapy. Like we all have parts of ourselves, and different parts kind of show up to protect other parts, right? And I do think for siblings, for siblings, it could definitely be trauma work because they're definitely feeling the trauma. They could be having big feelings. So it could be DBT to kind of manage the distress tolerance. But it's probably similar to everyone on this call, also just about being seen and heard and validated that this is really hard. And, especially like that someone asked about family systems on one of the questions. And I think, often in family systems, we kind of have identified patients, right? And then the kids who aren't the identified patients feel like, their entire world has been managed around the sick child, right? And it's an unpredictable sick child too. I don't have that because I have both my kids have it. But I think it's really important. I know there's some great sibling support groups, which are really helpful.
Yeah. I mean, they're not PANDAS based, but if you look up SIB shops, they're around the country and they're not diagnosis based, which can be great because it's not, it's, you know, it really widens the scope. So they're sitting in a group with other kids their age.
Yep.
And they're like, oh, so it's not just PANS. PANDAS the problem. Because like PANS is easy to blame. And of course it is a big problem, but they're like, oh, you have a problem too. Like you have a problem too. Like, and they really see that and talk to it. I know that my kids, you know, we were dealing with that autism for a long time. I mean,
Yep.
we still deal with the autism and the very severely impacted with autism. So my kid, one of my kids, his brother went to SIP shops and then he was diagnosed with PANS and it was like a whole other dynamic right there. And so it's always constantly evolving.
IOCDF, the International OCD Foundation, also has some really great groups and has sibling groups too. So
Yeah. You just have to, if you go in, you can go in by state and then you can go down and look. I don't think they list the family groups. They'll put in groups and then you have to weed through them to look for groups and it just kind of depends. And I mean, some of the NAMI groups a bit, they don't really have a lot of kids groups, but my cousin started NAMI Rhode Island for our other his brother. So when you talked about that, I got a big
Oh, and in Massachusetts, we have like PPAL. I don't know if that's national or not, but that's like a parent advocacy organization for those of us in Massachusetts. There's some really great agencies and supports and
just I tend to look up special needs, just special needs.
Yeah, absolutely.
And you get to, you know, parent to parent, or is that P2P? And a couple other different places. And each state, what they have on their websites is very different. Like sometimes it's not very helpful. And then sometimes it's very helpful. So you just have to, we don't keep a list of that. We do have our Aspire group where you can post in a question. And we have, we're going to start with Gusto. When I take a breath in the new year, some what we'll call chit chat groups, that they're Zoom groups. So they're they're facilitated just sort of by us, but they're not, there's no professional in there. So it's just, you know, us talking type of thing.
Yep.
So do you think it's helpful, or is there a value in seeking a diagnosis of CPTSD as a parent?
I mean, so here's, I did see that question and I thought it was really interesting. I mean, I think the value of it is that if you need validation for it, I think the hard part is, it is, again, it's kind of this multi-layered issue of finding someone who understands why this is such complex trauma. I mean, that's why I had to break it down, honestly, for myself to understand it best, you know, because it presents so unexpectedly, to be honest with you. And so while I do think there's always value because you feel validated and you feel taken care of, but I'm not sure even the CPTSD diagnosis totally encapsulates all of it. Do you know what I mean? That, I guess yes, it does. And I'm not sure it's, that, you know, maybe nuanced enough, to be honest. I don't know. But I always say, like, if people feel like they need that level of support, like, for sure. Yeah, I've never been diagnosed, but I'm going to guess we all have.
There was definitely a lot of information. It was really great. And then
I know I talked a lot. So thank you.
No, I'm glad you did. I actually really like the long webinars. People are like, oh, I could make it really short. I'm like, do you have to?
I just think it's like
it all in there.
Like you know, we have a story to tell. It's a big story. And like, we deserve the time and space to feel better. Like, this is really awful, to be honest.
I mean, and trauma and grief and shame is a big topic, and being able to understand why it happens makes it so much easier to be able to take the time and say, oh yeah, I am going to take that moment for self-care and figure out why I'm doing this and say, all right, I need to heal myself. Because you know, a lot of our times people are like, oh, I don't have time to self-care. Like, well, breathing, maybe the self-care and taking that pause is really what we're talking about. I'm not
Yeah.
talking about doing your nails. Like clearly I'm not talking about doing my nails. Bite those right off. So, but it's that self-care when we talk about it as Aspire and a lot of the other groups, we're talking about taking that moment to like realize, say, okay, I don't need to go into shame spiral.
Yeah.
I can take a breath. Like I can take 5 minutes to breathe a little and remind myself that this isn't my fault.
Yeah.
I don't need to get on every single roller coaster ride because they're not the ones at the amusement park. They aren't fun. And sometimes I have to get on them and then be able to take those
But
breaths.
we all get on them. Like
Yeah, no, we get all of them,
No
but the
judgment.
point was,
Yeah.
you don't have to get on every single one of them, right? Like,
Yeah. That's probably why we all feel so
sort of dizzy, yeah.
dizzy and nauseous all the time, right? Yeah.
Absolutely.
Yeah.
And take care of your health and check your cortisol levels,
Yep.
treat those. Not a doctor, but it can be very helpful.
It can be, for sure. Yep.
And things like that. And for some of us that know that we also have PANDAS or maybe different stages of them ourselves, being able to treat that too is really, really important. That, we may call that self-care, but that's called living.
Well, and recognizing that like our anxiety actually might have stemmed from, right? Like, I think we forget that, like we kind of think it's just our kids, but like our kids are part of us. So
they certainly are.
Right? I mean, let's be honest. So
anyway, so thank you, everybody. And
thank you, everyone.
Come back in a couple weeks. We have Patty Rice-Doran, who'll be talking about school and behavioral health.
Awesome.
And eventually I'll start posting who we're having in 2023. We may take January off because our speaker may have a case that she can't commit to a January date, but we'll figure that all out. And I'm looking forward to having a good year with everybody, and we're going to do it together, and we're
all in it together.
Come out of our shame cycle, and we're going to raise our voices and work on getting our kids to a better place and our community to a better place so that we can close that gap between onset of symptoms and treatment. So thank you, everybody, and be well.
Thank you, everyone.
It was fantastic.
Thank you. All right. Bye-bye.